Welcome back. In this video, we will go over the anatomy of the shoulder blade, the scapula. This is the scapula. It is a flat bone in shape. We have two scapula in the body. They are separated by the vertebral column. The scapula is attached to the rib cage right here. Each scapula articulates with two bones. The first articulation forms the shoulder joint with the humerus, the bone in your arm. The second articulation with the clavicle, which forms the acromioclavicular joint. On the model, we can see the scapula in its anatomical position. And based on that, this is the medial aspect of the bone right here. This is the posterior aspect. That is the lateral aspect, which articulates with the humerus laterally. And this is right here is the anterior aspect of the bone in its anatomical position. Starting with the first structure on the anterior aspect, this right here is the subscapular fossa. Notice how smooth this surface is to allow the scapula to attach to the rib cage. Inferiorly, we have the inferior angle. Superiorly, we have the superior angle. Superiorly also, we have the suprascapular notch. Right here, this is the coracoid process. We can also see the coracoid process from that view. On the medial aspect, we have the medial border. On the lateral aspect, we have the lateral border and we have the glenoid cavity right here. The glenoid cavity, it receives the head of the humerus. This forms the shoulder joint. Moving to the posterior aspect of the scapula, right here we have the spine. This is the spine, which looks like a shelf. And this is the acromion, which is the flat process. Don't confuse the acromion with the coracoid process, which looks like a bird beak. The acromion continues with the spine. This fossa superior to the spine is the supraspinous fossa. You can also see the suprascapular notch from here. This fossa inferior to the spine is the infraspinous fossa. Is that the right or the left scapula? To answer this question correctly, you need to imagine the bone in its anatomical position. The answer is this is the right scapula.